And have you ever thought about undergoing a little plastic surgery to take care of an area that maybe you're not too happy with? If you have, you're not alone. In fact, in 2016, Americans spent an estimated $16 billion on plastic surgery. And joining us to talk about the trends for 2018 is Dr. Gregory Wiener, a board-certified plastic and reconstructive surgeon with the art of plastic surgery right here in Chicago. Thanks for coming in today.
Thanks, Silvia.
Okay, so why are more people seeking out plastic surgery? Is it's more affordable, more acceptable? What would you say?
I think a little bit of all those things. I mean, what I'm seeing, especially in millennials, is, as we saw, they want to keep in shape. They're spending time on their bodies. They're health conscious. They're trying to achieve like a life-work balance, and they're looking for a natural look. If they want to make a change, they're looking for a natural look, less drama than what I've seen in the past.
Right, the obvious.
Exactly.
Which is interesting. Sometimes I worry that people start too young with some of these plastic surgery. When you're hearing people in their 20s are getting Botox and stuff, I'm thinking, is that really necessary?
Well, you know, I'm actually an advocate for earlier use of Botox because you might stop some of those wrinkles from happening earlier. But the rest of the stuff, a lot of the procedures, you know, too early. Yeah, you should wait. Absolutely.
Okay.
There's no question
So
about
let's
that.
talk about the trends. We are going to start with some of the more popular ones, and I understand rhinoplasty. I think that's the first one.
Right.
So we have some before and after pictures. So tell us what we're seeing here. Is this what's popular about this?
Well, about this is it's a natural look. It's a soft look. You're not seeing a lot of the sharp angles and upturns that you saw previously. I mean, patients want to look like themselves, especially with social media and things like this. I mean, patients aren't asking me for Charlize Theron's nose.
Right.
They're saying, make my nose look better. And so what we're trying to do is reshape things, create a harmony, you know, with the face, and create a soft look.
And that's really interesting as I look at this, because it is a little more natural. Because some of the plastic surgeries of the past, you could almost tell who had the rhinoplasty. Because they all look the same. There were these little bitty noses, right?
Yeah, you used to be able to tell which doctor did which nose.
Oh, you've been to so-and-so.
Yeah, exactly.
Okay, next is breast augmentation. Before we go to, well, we'll take a look here. So what are we seeing here when it comes to breast augmentation?
What you're seeing here is a computer simulation, which is kind of new. We're now able to take a 3D image and really kind of tell the patient or show the patient how they're going to look with a certain implant in. And so that's been a big change because we can give the patient more information than they've ever had. And we're also using different types of implants. We're using implants that are a little bit more cohesive, which means that they're a little firmer gel in there, which actually you'd think maybe that would be a firmer look, but it's actually a more natural look, less wrinkling. You can feel the implant less possible rippling, which is actually seeing the fold through the skin.
Is there still concern about implants leaking and, you know, causing problems for people? Because there's been all kinds of diseases related to that.
Right. Well, I mean, there is, as we know, currently there is no major diseases caused by breast implants. There is, however, one that's caused by the texturing on the implants that's been linked, but it's a very rare thing. For the most part, we're not seeing anything like that, and these have been the most tested devices in medical history.
You can feel better about them today.
Yeah, absolutely.
Okay, and finally, let's end with the lip injection. This is really unpopular, and here's the before and after. Right. And tell us what you've done.
Well, once again, it's a natural look. What I've done with lips is gone back to injectable fillers. The hyaluronic fillers. Hyaluronic acid is a molecule that's present in everyone's skin. It's manufactured into a gel. There's different brands out there, and I've gone back to the fillers because it's natural, it's safe, and it's fast, and there's very little downtime. I mean, everyone wants to have more longevity, and the downside of these fillers is that they don't last very long, 4 months, 6 months. But, you know, the fat injections, which I love for the face, don't last as long on the lips, less predictable. Implants, which also potentially longer lasting, they don't look natural. So we've gone back to the fillers.
I love that. Okay, very good. And where can people go to find out more about you?
theartofplasticsurgery.com.
theartofplasticsurgery.com.